Hello, everyone, and welcome to this YouTube channel. These videos help you to review Toronto notes, and we're currently reviewing the pediatric section in preparation for the QE1 exam. And we're going through common complaints as outlined in Toronto notes. And the topic today is breath holding spells. So breath holding spells are is a complaint that is experienced in the pediatric age. Like you can see in Toronto notes, the cyanotic type is more common and is usually associated with anger or frustration. In terms of epidemiology, as laid out as outlined in the Toronto notes, 0.1 to 5% of healthy children between 6 months to 4 years of life experience breath holding spells. And this usually would start in their first year of life. So this is really interesting because as high as 5% of healthy children can have this, and it would usually start in the first year of life. In terms of etiology, there's the cyanotic type and there's the pallid type. For the cyanotic type, it's usually because the child is provoked by anger or some upsetting event, and the child holds their breath and becomes silent. But this spontaneously resolves, or the child loses consciousness after holding their breath for a while. So that's the cyanotic type. Of course, the child is holding their breath, becomes silent, they go blue. So that's the cyanotic type, or and then it resolves or they lose consciousness. While for the pallid type, it's usually because the child falls or is frightened, and of course the heart rate is reduced because of the vagal stimulation from the fall or from the fright, and then there's cerebral hypoperfusion and the child loses consciousness. So those two types are important to keep in mind, because in your clinic you can see the mom or the caregiver complain of this sequence of events, or this is what was happening, and did the child go blue or go white, cyanotic versus pallid type. And you would be able to understand, based on the circumstances around that event, what is responsible for that spell that the child has experienced, and you'd be able to explain to the mom or to the caregiver. In terms of management, usually this type of experience usually resolves spontaneously, and it rarely progresses to seizure. The median age of remission is 4 years, and almost all children stop by 8 years. Now, how do you help the caregivers to manage this situation? The caregivers must understand what is going on each time this occurs, and they help their child control their response to frustration. Now, they also need to avoid drawing attention to that spell, and instead deal with the fright or with the anger or whatever emotion triggers that spell. It could also be associated with iron deficiency anemia. So, if you test for that and you find, oh, there's some anemia here and it's iron deficiency, you could provide supplemental iron. If the episodes are prolonged or frequent or triggered by non-traumatic stimuli, or if there's a family history of syncope or sudden death, then it's indicated that you carry out an in-depth cardiac evaluation, checking for prolonged QT syndrome specifically. So when the caregiver comes in and describes an experience of this child has suddenly gone limp, loses consciousness, and describes, oh, the child went blue or white or pale just before this happened, and describes the circumstances, we try to reassure them and explain to them it's very likely a breath holding spell. But if this becomes prolonged or frequent, then we want to investigate for cardiac causes, specifically prolonged QT syndrome. All right. So I hope that is clear, because we're going on to practice questions now. I'm including these practice questions for every video going forward, because I just feel like, even though this topic is a very simple topic. By doing some practice questions, it helps you to remember the few clinical pearls that we've just walked through. Now, if you feel this is totally unnecessary for you, please feel free to go on to the next video in the playlist. But I assure you that it just helps you to remember better. All right. So the first practice question here: a 2-year-old boy is brought to the clinic because of several episodes in which he becomes upset when frustrated. During an episode, he cries, he suddenly stops breathing, becomes blue, and loses consciousness. He spontaneously recovers shortly afterward, is otherwise healthy, has a normal developmental history. Which of the following is the most likely diagnosis? Is this an epileptic seizure? Is the cyanotic breath holding spell? A pallid breath holding spell? A long QT syndrome? Vasovagal syncope? Now, you may not get questions like this on the QE1, but this question is specifically testing something we've just walked through. So, high on our list of suspicion is the cyanotic breath holding spell because of the description of the circumstances around these symptoms that the boy is experiencing. So we go on to the next question now. A 3-year-old girl has recurrent episodes of loss of consciousness. Her parents report that the episodes usually occur immediately after she becomes frightened or if she falls. During the episodes, she becomes pale and briefly loses consciousness. Which mechanism best explains these episodes? A. Cerebral hypoxia caused by prolonged voluntary apnea. B. Cerebral hypoperfusion caused by vagally mediated bradycardia. Abnormal cortical electrical activity. That's for seizures. D. Prolonged QT interval causing ventricular tachycardia. E. Hypoglycemia causing cerebral dysfunction. And of course, the answer is B, because this is specifically describing what looks like a pallid type of breath holding spell. Question 3. A healthy 18-month-old child is brought to the clinic after several episodes of breath holding during tantrums. The parents are concerned that these episodes represent epilepsy. Which of the following is the most appropriate counseling regarding the natural history of breath holding spells? They usually progress to epilepsy by school age. B. They usually require anticonvulsant therapy. C. Most children continue to have episodes throughout adolescence. D. They usually resolve spontaneously during childhood. E. They require cardiac intervention in most cases. And of course, the answer is D. Um, Question 4. A 2-year-old child has recurrent cyanotic breath holding spells triggered by frustration. The parents respond by immediately giving the child whatever they want whenever an episode occurs because they're worried about the child losing consciousness. Which management strategy is most appropriate? A. Encourage parents to give the child what they want to prevent future episodes. B. Begin anticonvulsant therapy. C. Help the child develop strategies to control their response to frustration and avoid drawing attention to the spell. D. Restrict the child's physical activity. E. Begin long term cardiac monitoring. All right. So the answer here is obviously C. So it's best to help that child develop strategies to control their response to frustration. But while you do that, you're also avoiding attention to the spell. All right, question 5. A 2-year-old child is evaluated for recurrent breath holding spells. The episodes are typical for cyanotic breath holding spells. Lab shows iron deficiency anemia. Which intervention may improve the frequency of these episodes? A. Oral iron supplementation. So that's very easy. Question 6. A 4-year-old child represents with recurrent episodes of loss of consciousness. Unlike breath holding spells, some episodes occur without an obvious emotional or traumatic trigger. The episodes have also become increasingly frequent. The child's father died suddenly at a young age. So here, it's obvious that they're pushing you to investigate for something outside of breath holding spells. And with the father dying suddenly at a young age, it's showing more of a potential cardiac cause. So the answer here would be C. All right. The last question in this presentation today, a 20-month-old child has episodes of breath holding that occur approximately once every few weeks after intense frustration. The child becomes cyanotic, briefly loses consciousness, and then spontaneously recover. Growth and development are normal. Which feature most strongly supports a diagnosis of a cyanotic rather than a pallid breath holding spell? So I'm just going to pause here and see what's your answer to this question. All right. I hope that you have selected D, association with anger or frustration. All right. So we've come to the end of this video. I hope that this helped you to review this topic in Toronto Notes, and I'll see you in the next one.